The big government progressives in both the Democratic and the Republican parties have been trying to trick us. These folks who really want the government to care for us from cradle to grave have been promoting the idea that health care is a right. They have succeeded in moving the debate from whether the feds should micromanage health care to how the feds should micromanage health care. This is a false premise, and we should reject it. Health care is not a right, it is a good, like food, like shelter, and like clothing. Okay, what's a right? A right is a gift from God that extends from our humanity. Thinkers from St. Thomas Aquinas to Thomas Jefferson to the Reverend Dr. Martin Luther King Jr. to Pope John Paul II have all argued that our rights are a natural part of our humanity. We own our bodies, thus we own the gifts that emanate from our bodies. So our right to life, our right to develop our personalities, our right to think as we wish, to say what we think, to publish what we say, our right to worship or not worship, our right to travel, to defend ourselves, to use our own property as we see fit, our right to due process, which is fairness from the government, and our right to be left alone are all rights that stem from our humanities. These are natural rights that we were born with. The government doesn't give them to us, and the government doesn't pay for them, and the government can't take them away unless a jury finds that we have violated someone else's rights. What is a good? A good is something we want or need. In a sense, it is the opposite of a right. We have our rights from birth, but we need our parents when we are children, and we need ourselves as adults to purchase the goods we require for existence. So food is a good, shelter is a good, clothing is a good, education is a good, a car is a good, legal representation is a good, working out at the gym is a good, and access to health care is a good. Does the government give us goods? Well, sometimes it takes money from us and gives that money to others. You can call that taxation or you can call it theft, but you cannot call it a right. A right stems from our humanity. A good is something you buy or someone else buys for you.
The future of your health care. You can't see it, but it's happening behind closed doors.
Dodd and Bacchus and Reed are behind closed doors.
The sense that we're getting is that the details of this deal, this crucial deal on health care reform, there's still a mystery, even among Senate Democrats.
President Obama, Democratic leaders have decided to bypass a formal House and Senate conference committee in order to reconcile those two health care bills. Instead, White House and Democratic leaders will hold informal, that's another word for secret, negotiations, meant to shut Republicans and the public out of the process. What a far cry from the election, when then-candidate Obama pledged to, quote, broadcast health care negotiations on C-SPAN so that the American people can see what the choices are, unquote.
I mean, the president, despite all of his promises about transparency, I mean, the president made a big show of saying that all this would be done on C-SPAN for everyone to watch. When you get right down to it, where is it being done? Behind the closed doors in a dark of night. We're essentially having political horse trading with my health care, your health care, our children's health care.
What the freshman Republicans here want is what the American people want, and that is more transparency and a more deliberative process.
Speaker Pelosi promised the most open Congress in history, but the reality is anything but.
At the end of the day, it's the American public who is cheated when we don't have an opportunity to review what's in given legislation.
That 94% of the people are covered. What's happening is that they're being forced to buy insurance from insurance companies that can then pay that money, 30%, as Howard Dean says in the Washington Post this morning, to multi-billionaire CEOs.
Got rural conservative Democrats out there who want these negotiated rates, and they want the power to go to the states, and they want 50 different associations, and you say that's a victory for the insurance industry. You couldn't go along with that.
This ends up being a larger bailout to the insurance industry. I don't think that's what Democrats should stand for.
In the health care bill, it actually is going to limit your choices. You will only be able to buy government-approved insurance, pages 16 through 19. And I think that worries people. I'm in the business of eye surgery and eye disease, and one of the common diseases in the eye is abnormal blood vessels that grow into the back of the eye called macular degeneration.
Right.
We inject a drug called Avastin. In England, you had to prove that you were blind in one eye before they might let you use it in the second eye. Americans are going to be very fearful of losing their choices.
My name is Dr. Chris Truax, and I've been a chiropractic physician in town since 1988. I have 9 years of college and 4 degrees, associates in science, 2 bachelors in science, and chiropractic degree. I can't be in agreement with something I know nothing about, and there hasn't been any transparency in this. As promised during the campaign speech, it was supposed to be on C-SPAN, and of course it hasn't. So how can you be in favor of something that's shrouded in secrecy? People want to see, they want to know.
Yeah.
They want to see and know, and they want to be involved.
Right.
They don't want it to happen behind some subcommittee, behind closed doors. Well, they forced us to buy car insurance, and now they're forcing you to buy health insurance.
Mm-hmm.
So, yeah, superficially, it seems to be unconstitutional. And from what I've heard, if you don't have something in place, even you young guys, then you're going to get hammered by the IRS and have to pay $1,500 on your income tax. That's not right. I think part of if you're watching any of the TV programs, Republicans blaming the Democrats and the Democrats are blaming the Republicans, and I think it's time to get beyond this two-party system. I think we need more parties. More of my patients that are voting independently. Some sort of bipartisan, open airness committee meetings take place, and we can see, we might vote for something. You know, if there's a bipartisan outcome that people like, they would probably vote it. But until that time,
right,
you know, status quo.
Yeah.
Status quo. I'd rather see the status quo than have something be elected into place that we know nothing about. I've searched the chiropractic websites, and there's not a lot of either or. Now, where the medical profession is, I think they're against it, because for the same reasons. They don't know.
Right.
It's just you're gonna have to lift the shroud of secrecy, and then maybe the people jump on board, or maybe they'll turn against it as they have, the way it is now.